Live. The one and only Local 10 News starts right now.
Hello, everybody. I'm Christy Kruger, live at Mount Sinai Medical Center, detecting lung cancer at its earliest stages. I'll show you the technology that makes it possible. We're going to do a scan here live and actually bring you the results, too. That's all coming up.
And November is Lung Cancer Awareness Month, and today is also the Great American Smokeout.
So we want to make sure you're taking all the right precautions.
Our own medical specialist, Christy Kruger, live at Mount Sinai Medical Center on Miami Beach with Christy, why smokers should kick the habit.
Indeed. It's going to be very exciting here. We're going to do a live CT scan in just a moment. But we should tell you that lung cancer is the most common cancer in the entire country. It's also the deadliest because often it strikes with no warning signs at all. And that is why early detection is key. And for a very large number of people, especially those who have smoked, having a scan like the one you're going to see here live, well, that can be a real lifesaver. From his teen years until his mid-60s, Robert Minnick smoked cigarettes.
I used to get jobs part-time when I was a kid, and I was a golf freak, you know, and I would caddy for guys and newspaper route, and I had my money from my cigarettes. So at 15 years old, there I was.
2 years ago, on his way home from a model airplane expo, Robert's back suddenly started hurting, and the pain wouldn't go away.
It went for a week, and it got worse and worse.
A scan of his lungs revealed a tumor the size of his fist. Before he went in for his first round of chemo and radiation, doctors learned the cancer had already spread.
And they said they diagnosed cancer on my brain, and they immediately the following day, that morning, I had to have major surgery.
Today, smoking remains the #1 risk factor when it comes to lung cancer.
So 90% of lung cancers are associated with a smoking history. And that's why screening is so important, because if we are able to detect patients early, we can offer them curative surgery.
Clinical trials show that screening high-risk patients through CT low-dose scans can detect 85% of cancers at an early stage.
Once we identify a patient that has a pulmonary nodule, we can do a diagnostic procedure. And if some of those will end up being cancers that can be resected early.
After agonizing surgeries and several weeks of treatment, Robert is slowly making his way back. He hopes sharing his story will help others learn the importance of early detection and the dangers of smoking.
It's a habit, of course. Once you get hooked on it, it's all she wrote.
All right, so now we are back here live with a very brave man. This is 68-year-old Peter Gonzalez. Thank you for joining us, Peter. Peter has been a long-time smoker. Tell me a little bit about your history.
Okay, I started smoking when I was 15. I quit about 12 years ago in my 50s, 56, 57, someplace around there.
And Peter, as I say, is a brave guy because in just a few minutes, live right here on the air, he's going to have this low-dose CT scan. And tell me why it's important for you to really be out there and doing this for yourself and for others who are watching.
Because it's very hard to quit smoking. And I did it. And I want to know if it hurt me or not.
I mean, because if you can find out if there's something going on early,
correct,
chances of survival are a whole lot better.
Correct.
Are you a little bit nervous?
Yes, I am.
Just a little. And his wife, not surprisingly, is the one who twisted his arm a little bit to get him here, right?
Yes, yes, she did.
Shout out to you for saving this guy's life, maybe. All right, so in a few minutes, we'll be back. We'll have you on the table doing the CT scan. Thank you, Peter, so much. And then we're going to have his results as well live at about 5:55. So stick around. Back to you guys. Janine, Victor.
So brave to do that on live television. All right, Peter, we're going to be holding your hand through the television screen.
Live. The one and only Local 10 News starts right now.
And hello, everyone. I'm Christy Kruger coming to you live from Mount Sinai Medical Center. I'm going to introduce you to 68-year-old Peter Gonzalez. He has smoked for 40 years, but today he's going to have a test live right here on air that could save his life. We'll bring it to you on the other side of the break.
November is Lung Cancer Awareness Month.
It's one of the deadliest forms of cancer, but not if caught early. So let's check back in with our medical specialist, Christy Kruger. She's live out at Mount Sinai Medical Center on Miami Beach, where a patient is getting a lung scan right now.
Exactly right now. Thanks, Lori. Yes, we are right here at Mount Sinai Medical Center, and that is where right behind me, Peter Gonzalez, a very brave man, 68 years old, smoked for about 40 years, is having his lung scan done live right now. We're going to have his results in the next half hour. But joining me right now is Dr. Roy Williams with Mount Sinai Medical Center to talk a little bit about why this is so important. What is the CT scan and why is it vital for especially smokers like Peter to have this done?
Well, what this did is this is a game changer for us in this treatment of lung cancer. What the study has allowed us to do is to identify a risk of people who are at high risk for lung cancer, and by subjecting them to annual low-dose CT screening, we were able to find these lesions much earlier. And that's a very, very big thing with lung cancer.
Because if you can detect something early in its earliest stages, now there are treatments that can actually save these people's lives.
Right. The thing with lung cancer is that lung cancer is the most dangerous cancer. It's responsible for more cancer deaths than breast, prostate, colon combined. And very often people who present with lung cancer do not have any symptoms. So somewhere between a half and three-quarters of the people who present are already too far advanced to help. This allows us to get the people early.
And this is going on right behind us. We're doing 3 different pictures, and in the next half hour or so, we'll be able to see if there are some suspicious areas. Who should be getting screened? What person out there listening to us right now?
Typically, it's people who have a heavy smoking history. It's typically age 55 to 80 with about a 30-pack year history of smoking. That could be a pack a day for 30 years, 2 packs a day for 15 years. And they should be either still smoking or recently have less than 12 or 15 years
of not smoking. Okay, so we've got Peter in there right now. Thank you so much, Doctor, for joining us. This is a life-saving test for Peter and as well as for many other people out there who are watching. And on our website, local10.com, we have some places you can go for low-cost screenings right now. I'll send it back to you. We'll be back in the next half hour to see how Peter does. Fingers crossed.
Yes, fingers crossed. What a great technology. Christy, thank you.
And good evening, everyone. I'm Christy Kruger, live at Mount Sinai Medical Center. I am here because we just a few minutes ago saw Peter Gonzalez, our patient, get a CT scan, a low-dose CT scan of his lungs done live on air. These are pictures of his lungs right here. They're being read. The results for you coming up in just a few minutes.
We want to take you back to our live reports about lung cancer awareness.
Local 10's medical specialist Christy Kruger showing you how fast and easy it is to have your lungs checked. And she joins us live again right now from Mount Sinai Medical Center in Miami Beach with the results. Christy.
I am here with the results. I'm here with Peter Gonzalez, who's a very brave man to have his CT scan done live on the air a short time ago. Also here with Dr. William Burke, who is reading these results, and he's the man of the hour here, so I'm going to let him explain what he sees on these scans.
So, Peter, with these lung cancer screening studies, we're looking for pulmonary nodules. Typically, lung cancer starts as an abnormal soft tissue density in the lung, what we call a pulmonary nodule. And in this scan, we're really looking for pulmonary nodules that are about 6 millimeters or larger. So I actually have good news for you today, right? I don't see any significant pulmonary nodules, right? So right now, in terms of the lung cancer screening, we would keep you on a yearly annual low-dose lung cancer screening CT, right? We want to do that for up to 15 years, right? After 15 years of quitting smoking, your risk returns to kind of baseline population. So at that point, at least as far as studies go today, right, you could stop the following and the screening.
So tell me what you think. Are you still glad you came in?
Yes, I am.
Yeah.
Believe me, I am very, very glad. And thank you, doctor.
It's good to know you have a little peace of mind here, knowing that after all those years, 40 years of smoking, the lungs are still looking okay.
Correct. And you are afraid of doing this because you don't want to know, but you should do it.
Definitely need to know for sure. Now, he does have a little bit of emphysema, you mentioned, right?
He does have some mild emphysema, so it's really just very mild. So the earliest signs of actually some of the destruction of the lung that can happen. So it's great that you've quit. You just need to continue without smoking.
All right, so thank you so much to both of you for doing this today. And it's just a great reminder that you need to come in. If you've been a smoker ever, get this low-dose CT scan. It could definitely save your life. Back to you.
Good news for Peter. Christy, thank you.